I'm a senior research fellow and a psychologist. I work for an organisation called Orygen Digital. So we're part of the Centre for Youth Mental Health at University of Melbourne. So we're really interested in the ways that technology can address the youth mental health crisis at the moment, seeing massive issues in that space. So we've got lots of different digital programs that are trying to support the young people out there that are struggling with their mental health.
What sort of issues are you seeing at the moment in youth mental health?
So we've seen a 50% rise in the rates of mental ill health amongst young people over the last decade, despite the fact that we're seeing increasing investment in youth mental health services and a lot more research. The rates are going up rather than down, so it's worse than it ever has been. I'm sure a lot of the parents out there, I'm talking to a lot of parents here today about their teenagers that are struggling with mental health. We also have a really overburdened mental health care system. So the wait list to see a psychologist can be 6 months long, and if you've got a young person that might be in immediate need for care, then the risk of harm is massive. So those two problems combined really are led to the crisis.
Yeah. So talk to me about Orygen. What are they doing as a digital health space to kind of address that?
So lots of different ways. We have a few programs of work. We have MOST, Moderated Online Social Therapy. So that is an online therapy program designed to support youth mental health services. So we've been funded by various state governments to roll out that digital program across Headspace Services, which is the largest network of mental health services for youth in the country. That's got a heap of stuff on it. It's clinically supported by clinicians. It's got a peer network for young people to connect with others that are struggling with similar challenges. So that's our biggest area of work, MOST. We also have two really innovative new areas of work coming up. So we're looking at smartphone apps. We've got an app called Mellow that's designed for young people with depression and anxiety, to help with their worry and rumination. We've also got a really exciting, cool stream of work in virtual reality. So we've got a booth just over there, actually, with our VR headset set up. And so, people can come and check that out.
Tell me more about the VR. So I put the headset on. What does it look like?
So this is a really interesting area, actually, because, I was talking before about how, mental health problems are becoming worse, basically, for young people. We haven't seen a lot of changes in the types of treatments that have been available for the last 50 years. Same old treatments like CBT, seeing a psychologist. One of the really new things that's coming out that we're seeing some exciting findings from clinical trials is VR treatments. So what these look like is usually a clinician would be in the room with a young person. They would use the VR headset. Young person will put it on and they'd be immersed in an environment that's, helps them to basically develop coping skills and overcome challenges in the situations that they are struggling with in daily life. So a young person with social anxiety, for example, really struggling in a social setting, they really want to make friends, but they're really nervous to make those connections. So creating that environment and guiding them through to become comfortable and develop skills so that they can beat their personal goals, basically.
Amazing. So a bit of practicing the sorts of situations before you have to do it out in the real world.
Yeah. It turns out it's incredibly effective. Makes a big difference. It's like a stepping stone, really, to change in the real world.
And I guess, what are you hoping to see here?
I've been soaking it up. This is the first time Orygen Digital have come to the Digital Health Festival, so we're kind of just keeping our eye out, looking around to see what else is around here. Very interested in the mental health space, but even some of the things like this AI is a big, understandably a big topic at the moment, and some of the AI things that I've seen in neighbouring fields, health fields, have a lot of potential actually in the mental health space as well. So having a look to see what else is out there to try and inspire some thinking about new stuff that we can do in the youth mental health space. Always on the lookout for funders that may be interested in coming and talking to us about how we can scale up our work, because we do a lot of work on building and developing new digital mental health solutions, but we really need support to make sure that they have an impact on young lives. And I'm just soaking it up. It's really exciting, but we're at booth 503. If anyone is listening in or anything, then that's what we are. That's where we are. We've got the VR headset set up and the other platforms, MOST and Mellow as well.